you must be Bella.
Yes, hi, nice to meet you.
Nice to meet you too. My name is Miss Albie. Feel free to call me Kayla.
Thank you. Hi, Kayla.
What do you like to go by?
Bella.
Alright. So, did you have a problem finding the place, or?
No, your directions were great, thank you.
Glad to hear it. As you know, I was in contact with your doctor since you were referred to me by him. He mentioned that you met with him kind of recently, had some tests done, and the result was that you have celiac disease.
That's correct.
So,
I had extensive blood work done and a biopsy.
Alright. Were there any other things that came up, like a thyroid condition or anything like that?
No.
Alright, a lot of times celiac disease does go hand in hand with another condition, and it can be hereditary, so you want to make sure that everyone in your family also, gets blood work done and things like that to make sure that they don't have it.
I'll bring it to their attention.
Alright, and were you experiencing any symptoms?
Yes, I had bloatiness and some constipation.
That's definitely when people that do have celiac disease, there's a lot of different symptoms, so it's difficult to pinpoint one specific thing. But they can have joint pain, abdominal bloating, diarrhea, constipation, but a lot of times they just think, it's not a cause for concern.
Right, yeah, I was just feeling very sick.
And how long would you say you were experiencing the symptoms for before you ended up going to the doctor?
Just about 6 months.
Alright, and I understand that you did have other tests done to figure out what was causing you to feel different.
Yes, I did, and nothing came up till I had these specific tests done.
So this was like the last thing? Alright, well I'm really glad that you did go and get it checked out. It's very good that you caught it now so we can treat it. And did your doctor explain to you really what it is, or kind of left it up to you to gather the information?
He explained it to me, but it was just so much information to take. I just didn't understand it, and it made me frustrated. Then I went home and went online to try to see if I could collect any information myself, and that just made me more crazy trying to figure it out.
Well, when you go online, you want to make sure you're getting the information from a factual website. If anyone has access to the internet, then they can just go on and put, whatever they want, whatever facts they want. So you want to make sure what you're reading isn't misleading and that it's true. Otherwise, you'll be misinformed.
I was just so confused.
Alright, well basically, I'm sure your doctor did tell you celiac disease is when you have an allergic reaction to gluten. And gluten is a protein that's found in wheat, rye, barley. So basically no bread, no pasta, things like that.
Oh, those are some of my favorite things to eat.
Well, if you do eat gluten, it will cause the villi, which are lining your small intestine, to not be able to absorb the nutrients from the food that you're eating, which is called malabsorption. And if you continue eating gluten, your body will become malnourished because it can't take what it needs from the food that you're eating.
Wow, thank you for explaining that to me.
No problem. So I understand that you did have the symptoms, so you got it checked out and everything like that, and I'm hoping now you did cut out all gluten from your diet.
Yes.
Alright, I asked you to bring the 24-hour food log. Do you have that with you?
Yes, I do.
Alright, thank you. And this is from yesterday?
Yes, it is.
Alright, thank you.
You're welcome.
Alright. Well, I'm glad that you did eat breakfast. I see 2 eggs listed here. That's the most important meal of the day. I see for lunch you have a fruit salad, and for dinner you have gluten-free chips with salsa.
They were terrible.
The gluten-free?
Yes.
Have you tried any other products, like the crackers or anything like that?
Yeah, I just didn't like them.
No, well everyone has their own preference, so it's okay to not like it, but what you definitely want to do is figure out what other things to incorporate into your diet, so you make sure that you're eating balanced meals.
Okay.
Right, and I notice a lot of these are just snack foods. It's not like an actual meal, except for the breakfast. So would you say this is a typical day for you, or this is a day that you were in a rush, so you really didn't have time to prepare food?
No, that's pretty much a typical day.
Okay, and do you work?
Yes, I do.
Right, so this is food that you had while you were at work?
Yes, and at my job they always have like pastas and breads and things like that, and I just can't eat that.
Alright, well I'm definitely glad that you are avoiding the food that they have there. I know a lot of people will sometimes think, oh, it's okay if I just, have a little bit of this or a little bit of that, but it's not good at all because how one person reacts, another person will react completely differently. For example, if you had the pizza, you might have a reaction that lasts for like a day or two. Someone else can have it and they'll have a reaction that lasts a week or more. So it depends on the person, and you definitely don't want to take a chance because you don't know how your body will respond.
Right, I see.
And over time, if you do keep eating food that contains gluten, you can do permanent damage. You can develop other problems. Worst case scenario, you can develop cancer. So you definitely want to avoid gluten. Who does the majority of the food shopping in your house?
I do.
All right. And how often would you say you go to the store?
About twice a week.
All right. So when you do go, are you making sure to check all the food labels and everything to make sure that what you're buying is things that you can eat?
I will be more conscious of that now.
All right. And I can definitely give you a list to take home with you. So when you're at home, you want to look online at different products, or when you go to the store, you can have it with you. So you'll be aware of what you can buy and what you can't buy.
That would be great, thank you.
No problem. And I know it seems like you're very limited now, but there are a bunch of different options of things you can try. There's actually a website link that I'll give you that offers all different types of gluten-free foods, not just the chips and crackers, everything you can imagine. You can order it online, they'll ship it to your house, reasonably priced, so if your store doesn't carry it, you can still try it.
Thank you so much.
No problem. I can also give you a list of the foods that you should eat, so you'll know when you're shopping the things that you should lean towards.
Okay.
On here, the fruit and everything, that's perfectly fine. You can have as much fruit as you want, vegetables, beans and things like that. You want to make sure they're unprocessed, that nothing else is added to them.
Okay.
And if you're buying dairy, you want to make sure that it specifies it's gluten-free. You want to check the label and everything, because certain things may have it and certain things may not.
Okay.
So you always want to be 100% certain.
Alrighty.
And with the bread and everything like that, you also want to avoid cakes, pastries, cookies, all things like that, because those do contain gluten.
Oh, my birthday's coming up, so I can't have any cake?
Well, definitely not one from the store, but if you wanted to go online, there are many different recipes, and if you're preparing the food at your house, you'll know what's going into it. You'll be able to eat it without worrying about being sick or anything like that.
Okay, I'll give it a shot.
Right, and I'll definitely write down that for you.
Thank you.
No problem. Also, when you're going out to eat, do you go out often?
Once a month.
Right, well, definitely when you do go out, make sure that the waiter or waitress is aware of the celiac disease.
Okay.
So they can inform the chef or the cook not to cross-contaminate anything.
Really?
Meaning that, if they cut something with one knife, not to use it on your food, because the slightest, cross-contamination can actually give you a reaction.
Well, thank you for telling me.
I know there are people that go out even, if food comes with bread or something, they'll ask for separate silverware, just so there's not a risk of anything happening.
I'll keep that in mind, thank you.
No problem. Did you have any other questions?
No.
We covered everything?
Yes, we did. You were very thorough.
All right, thank you. Well, basically what I want to do is have you keep a 48-hour food log.
Okay.
It doesn't have to be 2 consecutive days. It can be any 2 days during the week.
All right.
Just so I can see what you're eating, seeing how your diet is different from day to day, and see what other foods you're adding. What I'd like you to do is bring some food with you to work, so you're not tempted just to snack while you're there.
Okay.
Maybe you could bring a salad with different vegetables and things like that in it. If you get yogurt that you can eat, mix it with some fruit, things like that.
All right, I will do that.
Right, just so you're not, getting not enough nutrition.
Okay.
On the food log, you did have eggs, which are a good source, and many different things, protein being one. If you have like a spinach salad, you'll be getting iron, things like that.
Okay.
And if you are eating meats, you want to make sure they're not breaded or anything like that, because that will give you the reaction.
Okay.
All right, and before you leave, I'll grab the sheet for you that has the different foods on it, as well as the website.
Thank you so much.
No problem. I'd like to make an appointment for this time next week, same day.
That sounds great. Thank you.
All right, if you have any questions or concerns or anything comes up from now to then, feel free to either email me or call me.
Thank you.
All right, no problem. Let me grab that sheet for you. It was very nice to meet you.
Same here. Thank you so much for your time.
No problem.